We are a all volunteer organization. So everybody that is involved with the organization, we all have lived experience with either family members or sometimes people that they themselves have issues, they can volunteer as well. So I've been dealing with mental illness in my particular family for over 40 years now. So I've been dealing with this for a long time. So the first time I came in contact with dealing with someone with mental health issues was when I was 20 years old. I had just gotten married. So my first husband was diagnosed with bipolar the first year of our marriage. We had just had our first child that shortly after we got married, and his father also got diagnosed with cancer. So those were two huge triggers that brought on his first episode. I had no idea that he had had an illness, and neither did he until this happened. So this was back in the 80s. There was really no talk of mental health issues. People didn't talk about mental illness. It was something that families, I think, mostly kept to themselves. There was no help for caregivers. I, as a young person, had no dealings with anyone. So I really felt alone. I felt ashamed to talk to anyone about his illness. So I kind of really kept it secret for a while until this really bad episode where he had to have hospitalized. But still, for years, we didn't tell friends, we didn't tell other family members and that. So it was kind of between us dealing with it alone, and there weren't a lot of resources out. I ended up staying married to him for 13 years. We had 3 children together. He was abusive, both emotionally and physically. He was very controlling with me, and so I stayed with him. I tried everything humanly possible to get him to see that he had issues and he needed to get help, and he wouldn't. So several years after we were married, about 13 years, and we had our children, we divorced. So then several years after that, my youngest son, who is now 37, was diagnosed with the same illness, bipolar. So it can be really difficult on a family member. I think especially if it's like a son or a daughter, I think if it's one of your children, it can be really hard. It is really heart-wrenching to see any loved one struggling with symptoms of mental illness. So often it can be hard to know how to best handle and help your loved one. Different people I found in your family and your friends will react differently to the challenges of mental illness. I mean, I had friends that like I had a girlfriend, her husband wouldn't allow her to go out with me or hang out with me anymore because he was afraid that my husband would, do something around his wife. So she wasn't allowed to come over and do things with me. Family members act differently. Now my daughter, my oldest, she's an RN, and you would think that she would be real empathetic and understanding. And she really doesn't have tolerance for her brother's illness. She really doesn't deal a lot with it. She just is kind of like, well, Mom, and it is what it is. It's not going to change. He's not going to change. And she really doesn't help out a whole lot with him. Now, on the other hand, my middle son, who's my oldest son, he is and has been his whole life best friends with his little brother. They shared a room together, so they were really close. So my oldest son is very understanding, very helpful. Many times he'll call me and say, Brian's not seeming right, or, Brian's doing some stupid things, and we'll discuss it between the two of us and come up with a plan of action. So he's really helpful. Now, I've got other family members that never even talk about it, which is really hurtful. There still is that stigma that people, they don't talk about it, and they just think that it's something that is brought on by the person. They don't understand that it's a medical illness just like any other physical illness. So that can be difficult for caregivers. So one of the things that I found myself, especially with my youngest son, was that I was denying the symptoms. I didn't want to believe it. I had these blinders on, like, this isn't happening to me again. I just got divorced. I dealt with this for 13 years, and I can't believe that now I'm dealing with it again, but now with my son. And I was devastated, and I was kind of not really acknowledging these symptoms, but looking back, I've seen them as early as probably like 9th, 10th grade. He was actually diagnosed as a senior in high school. He had my niece, who was only 2 months older than him, and they were very close. She got killed in a car accident her senior year. And that was a big trigger, and that brought on Brian's real first episode when he really got diagnosed and started having problems. So, one of the things that I always tell people is to try to find out as much information as you can about mental illness, whether it's they're diagnosed. You can look up, I look at all kinds of stuff on bipolar, and even other mental illnesses that are very similar. So just to educate yourself, I think, is really, really important. I wasn't educated when I was younger, and I know that I did a lot of the wrong things with my ex. I would tell him he wasn't hearing voices, that, I would use derogatory, language that I shouldn't have been telling him he was crazy and stuff like that. And once you become educated, though, and you truly understand that this is an illness just like any other illness, it's a lot easier as a caregiver to know how to deal with your loved one and how to come to terms with it yourself as well. So, you want to learn what some of the warning signs are, educate yourself about that. And just know that some of the feelings that you're going to have as a caregiver, at times you're going to, be upset with yourself, and just know that a lot of the feelings you're going to have are normal feelings. They're common among families going through similar situations. I run a support group for caregivers, and we very, very often, it's a really good place to be as a caregiver, because you see that you're not alone. Very often we're going through the same exact things. So it's good to know that other people are out there dealing with it as well. You're not alone. And share what you learn with others. Share it with family members and friends, so they can help understand what mental health issues are all about. So like I said, everyone's different. Situations can vary greatly. The person might have specific diagnoses, or you might just have concerns about the way a person's acting, how they're behaving. So some of the signs that you should be aware of are withdrawal from social interaction, unusual problems that someone might have in school or college, work, or social activities, where there can also be dramatic changes in sleep and appetite. And this was a big trigger, or a big symptom that was going on with my husband when we were so young. He wasn't sleeping at all. I mean, he was up all night long for like 4 nights straight. And I should have known that was a sign of mental health issues, but I didn't. Try not to be afraid to talk about it with other people. You'll be amazed if you do open up to other people. I talk about it all the time. I'm not embarrassed or ashamed of it at all. I know it's an illness now. I'm educated, and I'm surprised at how many people, when I bring up a conversation about it, how many people will say to me, yeah, my husband has depression, or, I myself have anxiety. So a lot of people, it's not something that you should be ashamed to talk about. So with your loved one, some of the things that you want to do is you really want to reassure them that you care about them, that you love them, and most of all, that you're there for them no matter what. It's always good to try and use I statements. For example, I'm really worried about you. I'd like you to consider seeing a counselor or talking with a counselor, rather than, you are or you should. Those I statements kind of keep the communication more open than you say, sounding like you're blaming them or telling them what to do. You really want to use patience and caring, and try not to be judgmental of maybe their thoughts and their actions. And that can be hard to do. I can remember, kind of being embarrassed when things would come up around friends or something like that. But, just keep telling yourself that, this is the illness and this is a symptom of the illness. So when they're talking, let's say they're hearing voices or they're psychotic and they're telling you things, try to just listen. Sometimes it's better to listen than to challenge them and say, you're hearing voices. There are no voices. So this is not real. It is real to them at the time. So just listening to them, and maybe you can even say to them something like, that must be really hard to be hearing things. I understand that you are hearing things, but I have to tell you, I'm not hearing them. But I know that you are, and, just talk about it with them instead of, disregarding or saying, no, you're not hearing voices. There's nothing going on. Sometimes just agreeing with them will get them to open up more. So encourage them, of course, to talk to a mental health care provider. Sometimes they might prefer to go to just like your primary care family doctor. Sometimes they're more comfortable with that. Now, with my ex, one of the things I found was that I think I told you he wouldn't admit that he had mental illness. Well, there's this word that they use called anosognosia, and it's pronounced different ways by different people all the time, but that's how I pronounce it. That's when someone is unaware of their own mental health condition. So they really, truly believe that they don't have a mental illness, that they have an illness and anything is wrong with them. There's something wrong with everyone else but themselves. So that is a big reason why they won't go get help. They won't take medications, because let's face it, if we were told, you have cancer and you really thought that you did not have it, you would refuse to go for chemo. You wouldn't take medication. You would deny it. And so that's what happens with them. So what I found with trying to get my ex to the hospital when he would get really, really like in a bad episode and just maybe be psychotic or whatever, I would try to have a calm talk with him and say, why don't we just go to the doctors and check and see, maybe this is something to do with like your thyroid. Thyroid can really affect the way you think and the things you do, and it can affect a lot of stuff in your body. Why don't we just go and have that checked out? And it worked. So I would get him to the hospital, and then once you get him to the hospital, they assess the patient, and they clearly could see themselves that he needed mental health help. So then he was committed into the hospital. So it made it a little bit easier on me at the time than to just keep arguing with him about it. But again, knowledge is power. The more you understand about conditions, symptoms, possible treatments, and what to expect, the better you're going to be able to support your loved one. So try to anticipate and help address potential barriers that they might have to seeking help. For instance, helping them out by calling therapists and getting the information about their times and how much it costs, and appointments, if they'll let you make an appointment for them. If you think there might be barriers such as like transportation, sometimes they don't drive or they have childcare, they need someone to babysit. They might need help knowing what to say to an employer. Help them out with these kinds of things. Offer to babysitter, offer to drive them and go to the appointment with them. So while you're focusing on helping your loved one, it's also really important to take care of yourself. And I know one of our speakers is going to talk to you about that tonight. But you want to take care of yourself physically and emotionally, reaching out for help if you need it, asking for help if you need it. I myself needed someone outside of my family to freely discuss my frustrations and hurt with. So I went to a qualified therapist. It took me a while to find one that I really clicked with. So don't be afraid to, keep going to someone that's not helping you out. But once you find someone, sticking with that person that you really mesh with. And I found someone that really offered me clarity, objectivity, and solutions that were not previously seen by myself, and a place also to safely deal with the enormous and difficult circumstances that you're facing. So like I said, I do run a support group, and I told you can go to the NAMI website to find out about them. We also have peer-led, meaning we have people that have mental health issues themselves, and they have support groups for your loved ones. We're all volunteers, but we are trained, like I said. We also have a 10-week program that I highly recommend to anybody that has a loved one with a mental health issue. It's a 10-week program that it's evidence-based, and it's taught by NAMI-trained family members that have gone through the same things you have. And each week is a different educational topic. So there's lots of information, lots of resources. We have a doctor come in and talk about medications. So that is a program that's called Families in Action. It's only offered twice a year because it is a big commitment for 10 weeks. But right now we're doing it on Zoom. So that'll be coming up in the fall. That'll be on our website as well. So if you feel, even if you feel that your support and actions aren't making a difference, they likely are making a big difference with your loved one. They might be hurting and not clearly recognizing what you're doing, or may not be able to express appreciation. But knowing that you're there for them, believe me, means a lot, and it is really important in helping in their recovery. So it's important to remember that there is hope for recovery, and that with treatment, many people with mental illnesses do return to productive and fulfilling lives. Thank you.
Terry, thank you so much for sharing your story and all of the helpful advice. I know we said we do all questions at the end, but I think this one makes sense to ask you right now. Is there, do you know of support groups specifically for parents?
Yes, I run one. In, it used to be in Clinton Hospital. Clinton is now, what is that, Ascension? Mm-hmm. In Rochester. And that is once a month, the first Wednesday. Right now we're running it on Zoom because they haven't let us have the room back. There is one also running on 19 Mile next to Henry Ford Hospital. And both of those sites have meetings in the room next door for people that have mental health issues themselves. So it's kind of nice. Like I sometimes would bring my son and he would go to the room next to where I was doing my group. And people do that really, you know, a lot of times. But yeah, we service Macomb, Oakland, and Wayne counties. So you can go to our website and there's a whole listing of all the different support groups according to where you live. And NAMI is nationwide. So even if you're in a different, like if you live up north or something, you can look and see what facilities are up there and what groups they run.
Thank you so much. All right, I believe our next speaker is going to be Angela Dusing, who is a parent support partner for community mental health. So I'm going to put the spotlight on Angela. Thank you for being with us.
Hi, thank you so much for having me. Like Amy just said, I am a parent support partner through Community Mental Health, and parent support partners are parents who have lived experience raising a child who has utilized community mental health supports. And so that's how I came to have this position. I have a son who's now 10, who has a diagnosis of ADHD, autism, sensory processing disorder, and generalized anxiety disorder. So a little bit of background about that. My son was about 18 months old when I started noticing just general developmental delays and just differences in him. I have an older child, and so there's just differences. Even though you're not supposed to compare children, you do get a feel for just the regular developmental milestones that children should be reaching. And as I started to become concerned, I really wanted to get him evaluated to see if there was any supports or early interventions, anything from early on that really could support him and help us. Because at the time, I believe he was around, at this point, like 2 or 3, he was not speaking. He had no language. He had a lot of self-harm behaviors. And as a parent, it's very distressing to see your child going through that and to not really be able to have a way to communicate with them and really find out what's going on. During that time, I reached out to a lot of my extended family and friends for support. And it was just something that I found people had a very difficult time supporting. I got a lot of responses like, oh, boys will be boys, don't compare them to your other child, things like that. But I knew something was different. And so I did a lot of research. I made 1 million phone calls. I spent a lot of time like digging in and trying to find any support or any services that would have been available for my son to help him. And I eventually received a phone number for Access Center through Community Mental Health, and I got involved in that. So we got him evaluated, and he began participating in ABA therapy. So we would have, once we started receiving services and got set up at the county, he started receiving ABA. So we had a behavior technician come into our home and worked with my son on average about 25 hours a week. So she became like a close family member. We saw her more than many of our family and friends. And it was really, really helpful for us because previous to that support and help that we started receiving through the county, we weren't able to take our son to really into any public places. We were afraid of judgment. We've had a lot of shame, a lot of guilt. We felt very, very isolated, not only from the community at large, but from our own like close-knit support network of our family and friends. And it's just something that they weren't able to understand. They've never been around another child that had similar issues, and it just became very, very isolating for us. So once we started really having that behavior technician like in our home and working with us, we were able to reach some of the goals that were set out in my son's plan, which was to like go to a grocery store and have him like successfully like remain in a cart, which sounds like a very like minuscule task, but when I wasn't able to take my son with me anywhere because of his behaviors, even those very little things, they just became like huge milestones that he accomplished and these big mountains that he climbed. So I'm so like forever grateful for the supports that we received. And really, you know, he had to do a lot of the work, working with the behavior technician in our home, but it was a lot of work on us as parents as well, because we really had to learn how to teach him to navigate the world to set him up for success. And it's possible, it's completely possible. It was just finding out what worked for him in his unique way. And we were able to do that, and we were able to set him up for, you know, for success. So once getting involved in those services, once he received that diagnosis, we got a lot of pushback on that too from members of our support system. Like, why would you want to label a kid? That's not necessary. That, you know, we got a lot of like that kind of feedback about my son having these diagnoses. And what I really found was that once we started getting my son the help and support he needed, once he received the diagnosis really became a protection or a shield for my son. It allowed people to see him not as this like very troublesome, problematic person, but as someone with a unique set of needs that can equally participate with everyone else. And so I found that, yeah, it really became a protection for him. People were able to extend empathy for him where they may not have been able to do so in the past. So it really came full circle when I started working at Community Mental Health as a parent support partner, because now I get the amazing privilege of walking alongside other parents whose children under the age of 18 receive services through Community Mental Health. I get to be their parent support partner and walk alongside them and create a space for them where they can feel less isolated. It's really, that's like my main goal when I'm working with parents, is to really like normalize and destigmatize the language that's used, and also to let them know that even though everything feels so isolating and you may feel alone, there are a community of people here that have also experienced it, and just to like normalize that experience. I felt that on my journey through all of this, we experienced almost a degree of grief and loss. When you have a child, you have all of these hopes and dreams and expectations for them. And when a child is given a diagnosis, and it's a spectrum, so we didn't really know where he was going to land on things and what his different abilities would be. And yeah, once we were able to look at that and see that, we were able to see that this doesn't have to be so isolating, and able to work through that. And so I really try to do that with other parents too, and talk about that, the grief and loss that may be felt and how that can be isolating. It changes a family dynamic when an individual receives a mental health diagnosis. And a lot of concern was about would my older child feel resentment? And we had a lot of concerns like that. But partnering with members from Community Mental Health, getting those supports, definitely reduced those feelings of isolation, that feeling of grief and loss, and really helped me turn it into a positive thing for our family. And I'm so privileged to be able to do that for now other members in the community. And another thing that I did want to highlight is Macomb County's mobile crisis line. And the mobile crisis is a team that comes out. It serves youth in the community up to age 21 in Macomb County. And the mobile crisis can be utilized when you feel that a child is experiencing a mental health crisis, if they're having any suicidal thoughts, if you feel that the child is maybe within the near future would physically injure themselves or another individually, whether it's intentionally or unintentionally. Maybe the child's exhibiting risky behaviors, or you just notice that there's a drastic difference and there's a lot of unusual behaviors present, or anytime that you feel that you would require immediate assistance to help prevent having to call the police or to prevent hospitalization for a child. So who can call mobile crisis for that support and that help? It would be any adult working with the youth who has parental permission to call. So that could include a parent or guardian themselves, caregiver, grandparent, school staff, or therapist. And then once you call the crisis line, staff will obtain like basic information about your youth, insurance information, birth date, address, phone number. You can then request the mobile crisis team, and a mobile crisis therapist that's on call will contact you, and also they will be deployed with a parent support partner, so someone that is in the position that I'm in. So that way you have a therapist that works one-on-one with the youth in the home that's struggling and having the mental health crisis. And then the parent support partner is there to help stand alongside and support the parent as that crisis is going on. The hours of operation for that are Monday through Friday, 8:30 to 9 p.m. and Saturday from 10 a.m. to 6 p.m. And I think that's it. Thank you.
Thank you so much, Angela. That was, we appreciate hearing your story and all of the other information that you shared as well. I am going to take the spotlight off of you, and I'm going to put the spotlight on Joe. Next, we have with us is Joe Galino, who is a community health educator for Care of Southeast Michigan. Thanks so much for being with us, Joe.
Thank you. Thank you. Well, just a little bit about CARE Southeastern Michigan. We are a nonprofit drug prevention mental health agency. We've been around for over 40 years, and our mission is really to build resiliency in individuals through prevention, through education, through support services for a better quality of health. Now, my story growing up, I didn't have any connection with any type of services. And if anybody told me about how to improve or that I was doing anything wrong, I would be like, don't tell me what to do. I was very rigid. My background of growing up in my family was a very rigid family. We had an authoritarian father, which was scary. Do what I say, how I say, if I say, when I say, and if you didn't, there would be pain involved in some way, either emotional pain or physical pain. So really my story is about the family dynamics and family stressors and some of that impact on myself, when I'll share my story, and then on the next generation when I had my son. So I grew up, hating that environment, really isolated, avoiding, protecting myself in any way that I can. So I was very low self-esteem. I wouldn't put myself in any vulnerable positions. And when I grew up, I said, when I'm a father, I am not going to be like my father. I'm going to make these 3 promises. I'm not going to yell and scream. I'm not going to whoop like my father used whoopings. And I'm going to have a really great relationship with my child. So I had my first child when I was 25. And through that parenting journey, I started breaking those promises. I knew what not to do because I didn't want to create that environment in my household. I didn't want to create that rigid, scary environment, but I didn't know what to do, right? So I took out some of the violence, but I really kept a lot of the control and the yelling. So I broke my first promise by not yelling and screaming because of the temper tantrums, because of the defiance from my son. I only had one and only son. And then through school years coming around, my son was diagnosed with a learning disability, but I didn't believe in learning disabilities. And he had some assessments for ADD, ADHD, and I really didn't believe in that either. Right. So I really struggled with putting him on medication. So we tried some medication for a bit, and it really didn't see any differences. And so we took him off the medication. But I just kept pushing. I just kept on thinking that I can change him, because I thought that if I can just show him that, you don't have to be this way. We don't have to fight. You don't have to kind of avoid your homework. You don't have to avoid these things. I just kept on trying. Like somebody said a little earlier, you have these expectations for your child, and when they don't meet them, it's really emotionally hurtful. You feel let down. You feel like it's a reflection on you. So by the time, I started using spanking in school when he wasn't doing his homework and he was failing. And then by the time he was 12 years old, we were fighting all the time. And to make a long story short, I ended up in a parenting class through the care agency. My career, 33 years in the restaurant business, that was my career. Didn't know anything about this self-help or mental health improvement resources in the community. If somebody told me how to raise my child, I would be pretty defensive and say, you do you, I do me. We'll see how your kid turns out, see how my kid turns out. And then at 12 years old, I realized I needed some help. So I ended up in a parenting class, and it just really opened up my eyes to understand that maybe some of my behavior was affecting my child, and then just understanding that there is a different way. There are alternatives out there, alternatives to, communication and problem solving and discipline. So I was creating a really stressful environment for my child, as well as myself too. So once I started taking that parenting class and getting new tools, getting new resources, started using them and changing the relationship with my child, everything started changing for me. They asked me if I wanted to be a facilitator to facilitate my own parenting classes. And my self-esteem was this big because I've been yelled and screamed at my whole life. So I was like, no way am I going to be the center of attention, be vulnerable for people to either to make a mistake and to be embarrassed. And I already screwed my kid up. So what the heck do I know about parenting, right? So I was really scared. It took them 2 years to talk me into becoming a parent facilitator. And finally, I did it. And I was actually pretty good at it. So I did it for free for 7 years because I was still in the restaurant business, cooking in private country clubs. And then I decided I want to get paid for it. So I went back to school, got some education behind myself. And now I've been teaching parenting groups for like 14 years. Now, through those pre-adolescence, some of the conflicts, some of the family dynamics and the stressors, my son started using marijuana and drinking, in his early adolescence, and dealing with depression. But now, after I got the education behind me, right, I got the information that Terry's talking about and understanding the behavior. So now I'm approaching my son. Well, my son's 31 right now. He's grown up and he's moved out, lives in West Virginia. But I did have a lot of time with him where I can start building a different relationship with him, start incorporating protective factors, start understanding that that child's behavior wasn't a flaw, wasn't a character flaw. It was just him trying to survive. Our lives and our brains are designed to avoid pain and gain pleasure. And when there's a lot of family stressors and dynamics in the home, everybody takes on a role to minimize the pain. So if there's a lot of stressors going on, whether through addiction or mental health or abuse or neglect or something like that, children and adults, we all take on a role to minimize that pain. Some of the role is to be a family hero, right? If I'm perfect, maybe mom or dad will stop drinking or change or not stop yelling at each other. Or the next role, like the scapegoat, they get in trouble a lot. Everything's blamed on the scapegoat. So now they go down that road and, they kind of pull away from the family. And they're always getting in trouble. And then everything is blamed on them. Now they're the rotten child. And then that just gives them more belief that they don't belong and that they are bad. And then another family role might be the lost child, which they isolate and feel like they aren't important. And another family role is the mascot of being the family comic, right? The comic relief of the family. So when we see some of these roles in these children, we have to understand that a misbehaved child is really a discouraged child. Something is going on. And once we get an understanding of the child's behavior, of the developmental stages that the child's going through, we can approach it a little differently. We can approach it with skills. And we'll talk about that through the questions and answers that you guys have and answer those individually there. But now, I'm a strong advocate now. Before, don't tell me anything that I'm doing wrong or that I could do better. But now I'm like education, prevention, get those resources out in the community. There's so many free resources in our community, and some people just don't know where they are, how to access them, or don't know how valuable they are. So thank you.
Thank you so much, Joe, for sharing your story. I am going to remove your spotlight. Next, we have with us Sharita Harvey, who's president of My Lifeline Center and chair of the Clintondale Coalition for Substance Abuse and Prevention. Thank you for being with us, Sharita.
Thank you for having me. So today I wanted to talk a little bit about the family dynamics of mental health. Everybody shared their story about mental health and how it affects the person, but I also wanted to talk about how it affects the family members. I noticed a lot of times in my mental health experience that substance abuse plays a large role in that. I worked in an inpatient facility for a number of years, and I noticed that a lot of people utilize substances to cover up the mental health issues, such as hearing the voices or the hallucinations, or just dealing with the fact that I don't feel normal and nobody likes to listen. And so one of the parts of that job that I loved the most was when we had to do family support groups. So we would have to do family education groups where we would talk to the family members and try to help them learn how to cope and understand mental illness. As a parent, I found a lot of times that people felt like if there's something wrong with my child, I did something wrong, or there's something wrong with me. So it's easier to pretend that there's nothing wrong with my child instead of trying to understand what the symptoms are or become educated on what the diagnoses are. So I wanted to share a little bit about anxiety and stress, because I felt that was like the number one issue that families dealt with. And I wanted to talk about the difference between stress and anxiety, and then just to provide some tools on how to manage as a family member. So I'm going to share my screen, and forgive me because I am not super tech savvy and my partners are not here with me today. So I'm going to be a big girl and I'm going to handle this on my own. So I'm going to share my screen with you guys. And I have a little PowerPoint here that talks about stress. So we'll start from the top. So I wanted to identify what stress actually means. When we look at the word stress, it just feels so heavy. Stress is a feeling of emotional or physical tension that can be caused by an event, a thought, or a feeling that causes you frustration, anger, or even nervousness. And it causes your body to react in a challenging or demanding way. Stress can be both healthy and unhealthy. Some people use stress as a way to motivate them to get things done. Some people can allow stress to be unhealthy because it starts to settle in. So let's talk about healthy versus unhealthy. Healthy stress is short term. It goes away in less than 30 days, and it helps our bodies manage dangerous situations. It also can occur when something new or exciting happens. Stress can be caused by something as simple as somebody slamming on the brakes or an argument with a family member. When it becomes unhealthy, you'll know because it has lasted longer than 30 days, and now your body is reacting even when there is not a specific crisis. So it's almost like your body is reacting to a trigger versus regular stress, your body is reacting to a situation. So stress versus anxiety. You'll know the difference by just paying attention to the little subtle things. Again, stress is caused by an actual threat. It's something that is short term, lasting less than 30 days. Anxiety is reacting to a trigger of some sort. Listening to the previous presenters as they discussed different symptoms of mental illnesses, when it becomes anxiety, we have to recognize different things that it comes from. So let's just go back to Terry, how she talked about her ex when he would become violent. Well, if you look at it from a child's perspective and they're looking at this environment, and then later in life, they hear people get loud, they start to feel stress, they feel anxiety, they don't understand why they don't like loud voices or being argumentative. And these are just ways that you can tell the difference between regular stress and anxiety. Stress comes because the actual argument happened the very first time. Anxiety comes from now, years later, anytime I hear or feel somebody becoming confrontational, I get anxious, I get worried, I get fearful. And so I just wanted to kind of point out the difference between regular stress and anxiety. Symptoms of anxiety and stress can also mimic each other, and they can also play a physical role in our lives. Simple things such as diarrhea, forgetfulness, even constipation, having a headache, having sexual issues. We don't realize all these things are caused by stress. I see a lot of people, we don't even realize it, but we have that jaw stiffness, but it's because we're constantly clenching our jaws or clenching our teeth or clenching our hands, and we don't recognize it. But these are just different ways that stress attacks the body. The difference between anxiety, you'll feel excessive worrying. You'll feel the tremors when you get put in a situation. You'll feel this overwhelming sense of panic and doom when you are experiencing a situation. So those are the little differences between stress versus anxiety. Chronic health risks can include high blood pressure, heart disease, diabetes, obesity, depression and anxiety, skin problems, and even menstrual issues for women. These are things that we have to be mindful of. When we are loved ones of people who struggle with mental illness, we don't recognize how much of a family problem it is than an individual. We want to put it as an individual issue, but it is in turn affecting the whole family. We have sleepless nights. We're not sleeping. We're not behaving well. We're not functioning at work. We're calling into our jobs because we have these emergency situations. We're overeating because we're stressed out, and we've been taught all of our lives when you stress, the best thing to do is be the problem with food, or we're not eating at all because we lack appetite. So I just want you guys to be aware of some of the things that can physically alter us when we're stressing as well. Some examples of positive stress: having a baby, getting married. I put divorce there because that's positive for some people, but it still causes stress, and I want people to realize that. Starting a new job, death of a loved one, losing a job, financial issues, moving into a new environment, problems in the workplace. These are all things that are going to cause stress. Again, those are basic, simple life stressors. When we allow it to affect our daily living is when it turns into anxiety, and it can cause us to have those other symptoms that we previously discussed. I wanted to talk a little bit about the nature versus neurology of stress. Stress controls the center that is located within our nervous system. So this is why we feel all the physical symptoms of stress, such as the sweats, the nervousness, the nausea, all those things that it feels like we are out of control of our own bodies. And I want you guys to see that there are different ways that we can regain that control back. So learning how to take conscious control of your involuntary nervous system through different types of practices of mindfulness and relaxation techniques. A lot of people will refer to it as dialectical behavioral therapy, DBT therapy. That is very important when it comes to stress and anxiety because it teaches you how to regain control over your nervous system. So some mindfulness and breathing techniques. There's a thing called body scan where you actually are paying attention, being aware of your breaths, being able to focus on it. I'm going to have this PowerPoint sent out to everybody because there are some links on here so that you guys can be able to see how to perform these different techniques. Hopefully that will be helpful for you. Meditation. I know you've all heard about meditation. Meditation is not as simple as sitting down, taking some deep breaths. You have to really learn how to focus and become one with your breath so that you can learn how to calm yourself down and prevent yourself becoming overwhelmed and stressed. Having healthy thought patterns. My mantra for this week has been all about having healthy thought patterns. We become what we think we are. And if we think we're doomed, that's all we're going to see is doom. Sometimes we have to talk ourselves into positive things, speaking life into ourselves, speaking life over our loved ones. Sometimes we get so caught up in the diagnoses, we forget that the diagnoses is a part of their behavior, is not a part of who they are. And so when we start to speak life back into those positive traits, like they love to read, they love to ride bikes, they love to laugh, they love to play games, and we have to find the way that we connect with them in those areas so that we can prevent the overwhelming doom that comes along with mental health or mental illness. Mindfully eating. We don't recognize how much our diet plays along with our mental health issues. We eat constant carbs, we're going to feel heavy, we're going to feel sadness. We eat or drink constant coffee because we haven't slept well. We're going to be up and anxious. We're thinking we're anxious, but we're just wired because we've had 6 cups of Starbucks today. So just being mindful of our eating habits because it plays a huge role in how we behave for the day. I'm sure you guys have met a hangry person and you just truly, like the commercial, want to give them a Snickers because they're not their best selves when they haven't eaten anything. So we have to be careful how we take care of our body because it will take care of us. And this just talks about some more healthy ways that we can take care of ourselves through diet. Yoga is another way that we can be able to become mindful of our body, mind, and spirit. Most people frown upon yoga thinking that is some kind of religious ritual, but yoga also teaches us how to combine physical posture, breathing techniques, meditation, and relaxation into one. Qigong is almost like yoga. It participates in the same stigma of being able to learn how to become balanced in your breathing. We have Tai Chi. And just regular physical exercise. Physical exercise can play such a huge role in our mental health. It releases some of that stress and anxiety and that physical ability. Most people that struggle with anxiety find difficulty being still, calming down, resting. And so exercise can help us burn out so that we can learn to relax. And some supports. The number one thing is having supports. There's outpatient therapy, medication assistant therapy, music therapy, psychiatry, social support groups, Al-Anon groups. Al-Anon groups are super important because it teaches the family how to deal with people. It's a support group for family members. So you have substance abusers, you have AA, NA, and all those things for them. But how does the family know how to understand substance abuse? And so we have Al-Anon groups and things like that for them. So, and also always, of course, there's Lifeline Center. We are an outpatient behavioral health center in Macomb County, Michigan. We're located in Clinton Township. We also have a location in Hazel Park, and we have therapists. We service children, adults, families, couples, and individuals for mental health. And then the last page is just our resource pages where you guys can find links to everything that we discussed today. I'm going to stop sharing the screen now. So I just wanted to say to the family members that in order to take care of somebody else, you must take care of yourself first. For those of us who have been on an airplane, that's the number one rule. You cannot help someone else if you don't put on your mask first. And so we have to be mindful that if we're not full, how can we pour into someone else? So I appreciate you guys for attending today. And I hope that you learned how to take care of yourself so that you could be able to take care of your loved ones. And I like to express this, and I can't express this enough. As much as you try to understand the diagnoses, please try to understand the person as well. Thank you.
Thank you so much, Sharita.
Thank you.
I'm going to remove the spotlight. Okay, so everyone, thank you again for participating with us tonight. We are going to ask a couple of questions. If anyone in the audience has some questions and would like to put them in chat, we're happy to ask those that come in as well. But some of the questions that we have so far, and anyone is welcome, anyone on the panel is welcome to chime in and answer as they see fit to these. Our first question is, as a family member, what can you do when your loved one resists treatment? Go ahead, Sharita.
Because, again, I worked in an inpatient psych hospital for multiple years. And what I saw the most was people resisting treatment. As a family member, the best thing you can do is be able to take care of yourself and learn different ways to communicate. Like Terry stated earlier, instead of saying you need to go to the hospital for this particular thing, how about we go get your thyroid checked? Like, you have to learn how to communicate with that person, because at the end of the day, it's always about communication. How do you make that person feel comfortable enough to even go get checked out? Because the system is the system, and nobody trusts the system that needs the system, right? So we have to be able to make that person feel supported regardless whatever they do. But at the end of the day, you're only responsible for yourself, and you have to make sure that you take care of yourself, because you can't force them.
Great, thank you. Did anyone else want to chime in on that?
Yeah, I'd like to add a little to that.
Sure.
You know, sometimes people resist some help, you know, somebody reaching out to them. And sometimes we just have to find out maybe why, you know, so they might have fear that it's putting too much financial pressure on the family. Maybe they have fear of being labeled. Maybe they have fear of, if they do go, then it's admitting that label, you know. So sometimes we just reflect to say, I can see you're really uncomfortable. I can see you're really scared. I can see you're really confused. You know, what's going on? What are you thinking about somebody asking you to, you know, go to the doctor? And it might be something that we could help them with. It might be to say that, you know, there's free resources. It's not going to cost the family money, or just get rid of those fears and that stigma, because that might be the reason why they're refusing treatment. And we just need to accept, talk, and find out the reason. But if they do resist after that, then just drop them off the information. Well, here's some information. Here's some resources. Here's a number. I'm really concerned. And then you can walk away after you drop the number, the resources off.
Okay, great. Thank you. Oh, go ahead.
Yeah, I have something just to add to it. You know, another good idea that I didn't talk anything about was that it's good as caregivers to find out who your people are, who you can put in your ring, so to speak, that are people that can stand behind you and help back you up on things. So sometimes, like for the case of a mother-son, sometimes the son doesn't want to listen to the mom or his dad, but he can listen to an older brother or a cousin or a football coach or whatever. So sometimes it's good to think of other people that might be able to talk to your loved one if you can't get through to them.
Great, another good tip. Okay, so the next question we had is what is the best time and or age to talk to someone about topics like mental health or suicide?
Well, I can start off on this one. I really don't know what the best age is, but they always say, talk early, talk often. Whenever you see that there's a struggle, even before any mental health challenge, the onset of any mental health challenge, you see the struggle, you see the stressors, you know, start asking questions, you know, how do you feel? You know, how long has this been going on? You know, have you talked to anybody else about this? So you don't have to directly talk about like mental health disorders. You're just identifying some of the stressors, some of the signs and symptoms of things that are pre-diagnosable. They're just stressors that affect that child or that individual. And then you're just going to bring up the conversation. Hey, I've noticed you've been, you know, really detached and really isolated and stay in your bedroom a lot. What's going on? You know, just to keep that conversation going and apply some protective factors by empowering them, giving them autonomy, giving them control over their life, giving them choices, giving them a safe person to talk to.
Great, thank you. Terry, did you want to chime in? You're on mute.
Joe kind of touched on, and I just wanted to say that, you know, talking to them early, you know, when they're young, if you notice things going on, you know, it's really a good idea not to let things go too long and feel that you don't want to say anything. And again, if you don't feel comfortable or you don't think they're going to feel comfortable, asking someone that they do trust to have a talk with them. Another thing, and this is just kind of off this, I don't know if it has to do with the subject, but you know, when to talk to someone about it, I found that driving in the car is a real good time to talk to someone when they don't want to talk about something, because you really don't feel like you have to look eye to eye with the person. So I find that I have a lot of really productive, really good conversations while we're driving in the car.
I use that card trick with my daughter about any topic that I think she might find uncomfortable. So I think that's a really good point.
Mhm.
Wow.
And you know, Terry, that's kind
Go
of
ahead.
funny. The only time my son would talk to about what's going on inside of him and tell me about his friends and stuff was when we went out to dinner. We're
Mhm.
sitting in a booth, you know, and that's the only time he would talk. He wouldn't talk to me driving, wouldn't talk to me at home, at the dinner table, in the living room. And it was just, you know, finding that maybe he wanted to go out to dinner more often. I don't know that.
Mhm.
Our next question is sort of a spin-off of the last one. How do you know when to reach out for professional help?
I kind of think that everyone is different. Myself, I am very open to going to a counselor and talking to someone personally about what's going on in my head and that. Now, if you were to ask my husband, who's in the other room, he would no way go and tell somebody he doesn't know his intimate things that are going on in his head. So I think everyone's different, and I don't know that there's any real point. I mean, of course, if it's a danger to someone's life, you absolutely want to very quickly get a hold of someone to help. But I don't really know that there is a clear-cut answer to that for me anyways.
Yeah.
Great.
I'd like to
Angela,
add.
oh, I'm
No,
sorry.
Sorry, go ahead.
Angela, did you want to chime in?
I just wanted to mention that, you know, as far as like when to looking into getting services and things like that, when you have younger kiddos, like my experience with my son, when if parents are feeling that they're noticing different things, or they might be concerned that there's any sort of, you know, developmental delays, early intervention is the key with that. So speaking right away, once you notice those things, speaking with your child's pediatrician, reaching out to community resources. I mean, the key of that is really early intervention, and there is quite a lot of programs out there that can help support. I believe even early on has programs that start as early as like a year and a half old for children. So early intervention is the key with that stuff.
Great, thank you. Joe?
Yeah, so when to really be concerned, I think it's a level of how it disrupts that person's ability to kind of work or go to school. I mean, could they work and go to school effectively, or is that impacted pretty good? Or the ability to carry out daily activities, or to engage in satisfying relationships. So if it's impacting working or school or activities or relationships, then, you know, what is the severity of that impact? You know, so if it is a kind of a severe impact that's inhibiting that person or that child to continue that, you know, those life activities, then it would be time to go talk to a professional.
That makes a lot of sense. Sharita?
I would like to add to everybody else, for a family member, how do you know when it's time for you to reach out and get help? When that person's symptoms start to affect your life. Like I said before, you're calling into work, you're having sleepless nights, you're starting to feel your body become different than its norm, then it's time for you to reach out and get some help as well. Being a caregiver, like Terry stated before, it is challenging. It wears and tears on you emotionally and physically. And if we don't learn to reach out for help, then we can easily become just as toxic as the diagnosis itself. So I think that it's important that we know when we need to reach out and get help. That doesn't make us less as a person, but like I said before, if we don't refeel, how do we help the person? So I think it's important that we notice our own signs and symptoms of when we need to reach out for help as well.
Yes, I think that's incredibly important. Thank you for that reminder as well. Okay, our next question was, sorry, I have a list here. How do you approach the topic of addressing signs and symptoms of the onset of mental health challenges with your loved one? I think some of you touched on this a little bit, but if anyone wanted to expand.
I can start it off.
Sure.
You know, in our parenting classes, we have this approach. It's a 6-step approach. I care, I see, I feel. Then we listen, I want, and I will. So when we approach the person, you know, I care about you. I'm really concerned. I love you so much. You know, that's like the first step. The second step is to just identify the facts of what you're seeing. I've been noticing you missing a lot of school. I've been noticing you been isolated lately. I've been noticing you've been, you know, self-harming. Whatever you're seeing factually, just identify that. And then let them know kind of the impact. You know, I feel really concerned when this is happening because, you know, I want to make sure you're safe. I want to make sure, you know, you're okay. And then listen. Right? We want them to talk. So we have to ask those open-ended questions. How long you been feeling like this? This is really, wow, you know what? That is really typical. A lot of youth go through that same thing, you know, kind of normalize it to let them know that it's common, right? And then kind of dialogue as much as you can, but then what you want to do, you know, I want to help you. You know, I'm willing to do whatever it takes. I'm willing to connect you to treatment center. I'm willing to, you know, see a doctor and those kind of things. Approach it really with concern and not with fear and tears.
Great. Sharita?
Add to Joe, I think it's important that once we get the person to having those conversations, we create a journal or a signs and symptoms sheet, which we can also call like a recovery safety plan, right? Because when the person is stable, the symptoms are no longer there. But how do we know when that person starts to backslide? Do we know before they know? But if we have a list of what the symptoms are, we can always come back to the table and say, hey, you know, I notice your sleep patterns are kind of off and you told me to let you know when that happens. So I think it's important to have a log of what normal looks like for that person and what the crisis look like for that person, so we can have those comfortable conversations, because now they are aware, we are aware, and we get to see when they're starting to fall off track. So I think it's important to have a journal, a log of symptoms, so that we can always have something to reflect back to.
Great. That's very helpful.
Yeah, that is something, that is a really good point, Sharita. That is something that we always tell our, you know, people in our support group, is to keep that journal. And, you know, even things like medications that they're on, because many of you, I'm sure, know this, that many times our loved ones are on different medications every time they have to go into a hospital, or every time they have an episode, they get medication switched, or they have a bad reaction, or a medication stops working. And it's so much easier to have your stuff on paper and you can go back to that. Another reason is if it ever gets to the point where you might have to file disability for the loved one, you are going to need all of that proof and medications, doctors' names, you know, just keeping that, you know, for yourself. And then you're not like just really struggling when you need that information. So I'm glad you brought that up, Sharita. That's something that's really important.
Thank you.
And Terry, your answer sort of, Angela, did you want to chime in? No. Okay. Your answer, Terry, sort of segues nicely into one of the next questions is, how do I know when I should put my child on medication? It's a tough question, and I recognize that there's no one answer.
Well, I would say you first start by understanding that you don't put your child on medication.
Right.
It would be under the guidance of a professional. So
Yeah.
when you take your child for an evaluation, you hear what the specialist has to say, and then you make a decision whether you think it's healthy or unhealthy for your child based on the research you do. But we have to remember, we don't put our children on medication because we're not qualified to do that. And even if we were, we couldn't give our own children medication anyway.
You know, I'd like to share something that happens in the parenting classes that other parents have shared, that a lot of parents really are against medication, right? I don't want to medicate my child and stuff. But just like Sharita is saying, if that child has a professional diagnosis and he is diagnosed or she is diagnosed with that disorder, medication could make all the difference, right? So not just medication and forget about it, but medication and talk therapy and building resources, building coping skills, and then weaning off the medication. But to start on the medication could be the world for you as well as that child to, function.
Yes, very important to remember. Just a couple of more questions and then we're done. I think this might even be our last one. What can a person do to build resiliency in their family?
Well,
I would
go ahead, Sharita. Oh, you.
I would say communication, because the more we talk and we educate ourselves, we allow each other to feel comfortable. Again, I think Joe said it earlier, people become more resistant because they don't understand. Lack of education can cause us to withdraw and shut down. It's very important for us to have these uncomfortable conversations because it makes us become comfortable with it, because now we understand what it means. Now we can talk about it. Just for all of us as panelists, we've all experienced mental health at some capacity and thought that we were abnormal or our situations were abnormal until we became educated about it. And now we're out here spreading the word to the world, because the more you know, the more you grow.
Yeah. And if I can add to that, because I really love this resiliency topic, and Emmy Werner, who did the study in Hawaii with like 698 children that all had challenges, mental health and abuse and substance use, and parents that had all kinds of adversity. And some children made it, some didn't. And she came up with these like 4 bullet points, like autonomy, to raise our children and give them opportunities to make their own decisions, right? To say you are in control of your life. You know, those helicopter parents and the parents that want to take over and do everything for their child could be taking a big skill, because autonomy gives you power. And then problem solving. Instead of solving the problems that arise, even a bullying problem, you got 10 ideas on how to solve that, but you're going to say, well, what can you do when this happens, to help that child be involved in solving problems? And then social and emotional intelligence. So when they have a feeling, you're going to say, like, the kid's scared of the dark, or there's a monster in the closet, and you say there's no such things as monsters. Well, then that child says, then what's wrong with me? Because I'm scared. I must be stupid. Just say, wow, you must be really scared that there's a monster. You think there's a monster in the closet. Man, that's scary. You're actually letting him know that that feeling is okay, but this is a big thing. Now you say, what can you do to be less scared? So now being scared is normal. And now you're letting that child say, well, can you check in the closet? Can you look under the bed? So he now or she now is managing their own emotions. So you're building that emotional intelligence in them. And then having a sense of purpose, right? That every child, every person has a sense of purpose. And without purpose, what's the sense of going on, So we need to really help identify gratitude and purpose with these, with the children. So autonomy, problem solving, emotional intelligence, and purpose comes from the Emmy Werner study for resiliency.
Great. Well, I just want to thank you all for joining us tonight. I want to thank our attendees in the audience for watching along with us tonight. We've recorded this, and a copy will be available on the library's YouTube channel. We have another programming coming up in April related to community mental health that we hope people will attend and share with others who may find the information useful. But mostly, thank you to all of our panelists for being with us tonight, for being so vulnerable and sharing your stories. I think a lot of people are going to learn a lot from all of you. So thank you. We appreciate it. And I hope you all have a great night.